So I've been very proud to be seen through the Castle Connolly system as a top doctor, recognizing the acknowledgement comes from my peers and seeing um, my name there is a personal highlight. I am very committed to the quality of care that I provide to patients, and other doctors recognizing that means a lot to me. I think in medicine, everybody is driven to do the best they can in this profession, and we set a high bar for ourselves about taking care of our patients in the best way possible, and to be seen as a model of that and recognized by my peers is particularly gratifying. It's not always something that I would make an announcement on or try to emphasize to my colleagues directly, but having that recognition indirectly from my peers, which I think comes from the patients that they take care of, is really a true honor. So I've been a practicing urologist for over 20 years, and my path to urology was circuitous. I always thought I was going to be a specialist in cancer care and be an oncologist, and I was drawn to medicine by the science and the research that goes on in medicine. And in cancer care, I always thought that was a type of problem that I was really committed to helping patients and individual patients, and not only hopefully helping them at a single personal level, but helping populations of people with cancer. And I ended up in urology because I started my medical training and realized I just loved the ability to operate and help people in that way, which was unique and distinct from the current standards for cancer care, which was primarily chemotherapy and medicines. And as a urologic oncologist at Fox Chase Cancer Center, I'm really able to blend both of those interests because we take care of a lot of patients with advanced medicines, and the field of research in urologic cancer therapy has been amazingly advanced in progress in the last 10 years. And still, surgery is a really key part, and I have developed a skill and experience with surgery that I think is unparalleled outside of the partners that I work with. So we really have an exceptional team of surgeons. So I'm really proud of my background being Asian. My parents are immigrants, and I'm the child of immigrants to the United States who came for the traditional American dream of success, and they instilled emphasis on education and professional careers. And I have a lot of respect to all of my patients in their various backgrounds. And I think while I suffer in my limited language skills, and it's one of the things I regret that I'm not better at a second language, I think I am able to relate to a lot of patients, especially from different immigrant backgrounds, because they can have difficulties navigating the medical system in general, and especially in some of the complexities of cancer care. I'm really patient and can recognize some of the difficulties and barriers that they may face. And even for Asian patients who may seek me out thinking that I can speak in their native language, and unfortunately I often can't do that, I think I have a level of understanding of what they're aiming to say and what they're aiming to communicate in nonverbal ways. And there's a lot of cultural, behavioral, non-verbal communication that happens for a lot of patients, and I think they are able to appreciate my ability to see that. So I've been very privileged to be at Fox Chase Cancer Center, to be involved in a really forward-thinking organization looking to address the needs of various populations. And the Asian community has a number of just traditional higher risk problems that can be addressed with education to try to improve the understanding of certain types of diseases and cancers that are often unrecognized or perhaps ignored. And it's helpful to be able to be a member of the community to help lead in some of the educational efforts, and hopefully be able to change some of the stereotype that I think a lot of Asian AAPI in general, immigrants and people of that community tend to be often quieter and less outspoken, and perhaps may not advocate for their care as well as they should. And so being receptive to help along patients who may not be as proactive about seeking out care or addressing issues that they just handle and are sort of accepting as being normal, and that we can hopefully help recognize that some things that people just take for granted or think are fine can sometimes be underlying significant medical problems and need to be addressed. So I think the situation with DEI and how that gets addressed is challenging because there certainly is a need to continue to build diversity at all levels in both physicians and other members of the healthcare team, and even going as far as every person who gets seen along the way. It would be nice if there was diversity at all levels of what a patient interacts with the system. And I think there's a challenge that there's been a reliance on policy and things like affirmative action, where it tends to often suggest that some people get brought into an organization or are recruited in a certain way and they're not qualified, and it's more of a diversity hire, using that term. And I think far and away, people who are hired in a DEI initiative are fully qualified, and they just haven't been given the opportunity to be offered that position. And I think there needs to be hopefully a greater cultural acceptance that having a DEI program doesn't diminish the quality and the ability of hires and people in these positions to be fully capable, and often they're superior in many of the things that they accomplished, but they're just not given the adequate opportunity. So medicine has been changing rapidly in the course of my career, and I feel like I just started yesterday, but a lot of things continue to develop. And I think technology is going to play a bigger and bigger part in medicine, and some of it could be as simple as making it easier for patients to communicate and have educational messages conveyed to patients. We're so familiar with getting contacts from businesses and getting texts and getting requests for marketing, and that technology could be easily adapted in ways to help communication between patients and doctors. And one example that we've been working with development is in patients who have an operation, to be able to follow up with how they're doing and not necessarily rely on an individual phone call, because it's hard to have enough time to contact everybody one by phone, but to send out scheduled and intentional communications through text messaging and check up on people, and be able to help make it easier for a patient to notice something that may not be right and to communicate back. And so I think just the ability to have better technology to make it easier to communicate and have contact with patients is going to make some of the barriers that exist in healthcare diminish. So AI is a hot topic in every part of society, and medicine certainly is excitingly investigating ways to apply AI. And I think for patients, AI probably has an exciting ability to help personalize what might be offered in treatment, and ultimately the kinds of steps that are taken in addressing problems. I think we're commonly taught through medical training that there's often one step and one pathway and one algorithm in addressing a problem. And for many patients, they have options where they might make very reasonable choices, and some treatments and some choices of recommendations might seem a little aggressive, and they would be willing to do something a little less aggressive, if the side effects are less, in these generalities. And an AI system might make it easier to better query and survey patients about what their priorities are, and be able to provide better insight into what a patient's priorities and main objective of their long-term healthcare is. And especially as the population in the country gets older, it's not only trying to have people live longer, but hopefully have them live better and have better quality of life. And sometimes those can be decisions that split in different ways, that we can extend people's lives, but sometimes we make their quality of life worse, and some people wouldn't choose to do that. And I think some of the AI models for interviewing patients and surveying patients and getting preferences over their priorities could be really helpful. So medical care has shifted a lot in the last decade to really be aware of patient priorities and what's called patient-centric care. And I think individual doctors and providers of healthcare have similarly recognized that they're not needing to be so paternalistic in recommending something and saying this is the way it's got to be. And there's lots of means to balance objectives that are medically right, but also recognizing the goals that the patient may have at individual levels. And I think, as I said, with AI and developments, it's hopefully going to allow a broader understanding of the range of possibilities that exist, and a lot of emphasizing the patient's goals is getting their own insight into what their preferences are and what they would prioritize in their long term, and having them educated on the different choices that exist. And so education could be hopefully advanced in all ways so that decisions can be easier to make.